The women in these photos are sharing their experiences with breast cancer.
They're really telling the truth about the struggles that they faced throughout their diagnosis.
Michelle Adrienne is the creator of Uncovered, a project launched after her own breast cancer journey to raise awareness about the unique struggles Black, Indigenous, and women of color face with the disease.
Could be from lack of images of scars, like my situation was, to misinformation about what radiation burn looks like on melanated skin.
It can be so close.
Francine Holness was diagnosed with stage 4 breast cancer this year after she discovered a lump in her breast.
I'm processing my mortality.
At 43, with no family history of the disease, she had not yet started regular breast cancer screenings.
I may have 10 years. We don't know. They've given me 2 to 7.
There isn't a lot of information on women of color and cancer rates in Canada, but data from the US and UK show disparities do exist compared to white women.
Black American women tend to have triple-negative breast cancer, which is a more aggressive form of breast cancer.
This surgical oncologist says the lack of race-based health data could be impacting health outcomes.
I do think our screening guidelines might have to be different because we know some data that Black women present at an earlier stage.
Earlier screening could help, but another issue is a lower rate of cancer screening among Black and immigrant Canadians. That's what the Taibu Community Health Center has been working to improve.
For some members of the community, they were really not terribly concerned with cancer screening because they weren't seeing a lot of data specific to Black or racialized communities.
In 2013, the center developed an Afrocentric cancer screening program that included culturally sensitive education pamphlets, outreach, and a targeted phone calling program. And it worked.
We saw our breast cancer screening rate triple, and our cervical cancer screening rate increased substantially.
And screening for colon cancer nearly tripled.
Now on these walls you're seeing.
As for Holness, she's already talked to her daughters about screening.
Let them navigate, ask questions, advocate, push when they need to push.
And hopes her story will help others too. Tashana Reed, CBC News, Toronto.